If you have ever suffered or are now suffering with neck or back pain and you would like natural solutions, you clicked on the right video. I'm Dr. Cori Stern. Welcome to my channel, Take Control of Your Health. If you have been watching and haven't yet had a chance to subscribe, please hit the subscribe button now, as it is my reward for delivering this information to you. If you like the video at the end, please don't forget to hit the like button because it helps more people to find it. And last and most importantly, if you know anybody that you think would benefit from the information that you hear, please share it with them. So let's get into today's topic, which is neck and back pain. And I'm saying neck and back, but really your spine starts at the base of your skull and goes all the way down to the top of your butt. So your neck and back are connected. It's all part of your back, but we'll differentiate it because some people have neck pain and some people have back pain and some people have both. So I want to talk about what can cause back pain. And I want to make sure to say that if you have very, very severe pain to the point that it's unrelenting, no matter what position you're in, nothing relieves it, or you have other symptoms like nausea or vomiting, this might be an actual medical condition. For example, kidney stone can cause that, or a tumor. So if that is the case, then you need to get that checked out with a health professional. But what most of us have is run-of-the-mill, just back discomfort. Occasionally it can get severe where you feel like you can't move, or you do move, it's too painful. And then some people just have chronic low-level pain all the time. I am an expert on this subject, both from the viewpoint of me having had this problem for many years myself, chronic back and neck pain, and also by degree, I'm a chiropractor. So I have a lot of professional training in dealing with it and have had many patients over the years come to see me for help with this. My own pain started after I gave birth to my son. My son was almost 11 pounds and I had a cesarean section. So my abdominal muscles, my core muscles were weakened by the surgery, by when you have a cesarean, your muscles get cut. And then, they're handing me this almost 11-pound weight without giving me enough back support to handle him. And then I started developing back pain literally the day he was born because of that. And it's been a journey to handle my own back and neck issues. And we can probably talk more about that during the video. But the reason that back and neck pain are so common is because your spine is designed for optimal mobility. So you are able to move your spine, move your back, your middle, your torso. You're able to bend it forward and backward and sideways, and you're able to twist, right? That's a lot of mobility. And with your neck, back and forth and sideways, and turn it. So with all of that mobility comes a price, and that is instability. It's just easier to injure it. When there's more motion, it's easier to injure it. There's also a lot of different parts to your spine. There's your actual spinal bones, your vertebrae. Those don't usually hurt unless you fall on them or you fracture them. If you have osteoporosis, loss of bone mass, they can just fracture spontaneously. But usually that's not, your bones are not the source of the pain. You also have joints in your spine. You have a lot of joints. Like the spine goes from, as I said earlier, goes from the base of your skull all the way down to the flat bone that sits on top of your butt crack, which is called your sacrum. So all that whole spinal column has joints all the way down. So the joints are what allow the movement, and so there's a lot of motion going on in joints. Joints can develop arthritis. You can see my arthritis video for more information about that. There's also in between each bone, there's something called a disc. The discs act like a cushion. The discs have a little bit of a gel substance in the middle that cushion the cushion the shock on your spine. So the discs are made out of something similar to cartilage. They can tear, and the gel stuff can start leaking out, and then that can actually cause pain or inflammation, and that can end up pressing on nerves, spinal nerves. So you also have nerves in your back. And well, let's see what else. You also have ligaments in there. Ligaments are what hold your bones together, your joints together. And then tendons are where your muscles attach into your bones and muscles themselves. So all of those structures, there's a whole bunch of them. Any of those can be causing pain. Now, when you have back pain, if you go the conventional medical route, let's say you go to a medical doctor and they'll do an x-ray, and very often they'll say, oh, you have arthritis, that's why your back is hurting. That's usually not the case. Almost everybody develops arthritis. That doesn't mean that's the cause of your pain. Most common cause of pain is muscle spasm, muscle tightness. That's actually the most common cause, or muscle injury or ligament injury. So we call these sprain strain injuries. So, just the way you sprain your ankle, you can sprain your back. Also, if you get an MRI, they might tell you that you have a disc herniation or that you have disc disease. It's called when your discs dry out. As you age, your discs dry out a little bit, and they get less. They offer less padding, less support, less shock absorbance. So when you have a disc, a torn disc or a dehydrated disc, if a conventional doctor reads that MRI, they might just assume that's where your pain is coming from. That's not necessarily true. If you've been in a car accident and you got an MRI and it shows that you had a disc herniation, everybody will assume that it was from the car accident, which is not necessarily true. 50% of people walk around with disc herniations and don't know it because they're not always symptomatic, right? So getting back to my original statement, muscle is the most common cause of pain in the back. And we'll talk about how that happens. If you have a true herniation, it can heal. I have people that come to me for help with back pain telling me, I have disc herniations, and I'll say, when were you diagnosed with that? Oh, 15 years ago. You shouldn't have an injury that lasts for 15 years. It should heal. So if it doesn't heal, something's wrong, right? And people make this assumption that if they have a herniated disc, that they're going to have it forever. In my world, I help heal herniated discs, and then they're not herniated anymore. It's cartilage. It can repair. So let's talk about the most common causes of routine back pain. And what I see in my patients as the most common cause is the wrong mattress. So how much time do you spend laying on your bed? It's really important that you have the right mattress. So the right mattress means that it's not 20 years old. Mattresses wear out. I have so many people with old mattresses. They generally don't last longer than 10 years. And some of them don't last that long. Some mattresses wear out faster than others. the question I'm always asked is, what's the best mattress? And there's no right answer to that because it depends on your body. So the best thing to do really is to get a mattress that you can try out. A lot of companies let you try the mattress for 90 days and see if it works for you. And then once you get a mattress, you should be rotating it on a regular basis, either head to foot or flipping it if it's flippable. And pillows are also important. So pillows support your neck and you need the right pillow. And again, pillows don't last for years and years. Some pillows don't last more than a few months. So it is important for you to recognize when your pillow is not adequately supporting your neck. And the pillow should fill in the space between your neck and the bed, neck, shoulders, and the bed, so that it's almost like wearing it like a shawl around you, whether you sleep on your back or your side. And I like customizable pillows, so you can figure out exactly how hard or soft you want the pillow to be and exactly what they call profile, whether you need a flatter pillow, a medium, or a really fluffy one. It all depends on your head and neck. Same thing with a mattress, by the way. Don't assume that a firm mattress is the best thing to have. It's not for everyone. I can't sleep on a firm mattress. I feel like I'm laying on the ground and my back stiffens up when I sleep on a very firm mattress. So that's why it's really important for you to figure out what's best for you. But a customizable pillow, you can design it to meet the needs of your neck. So for example, I sell a water pillow in my office called ChiroFlow, and there's water on the bottom of it and fluffy stuff on the top, so you're not sleeping on water, but you put as little or as much water in it as you want to make it comfortable for you, and you can adjust it. And there's also shredded memory foam. Shredded memory foam you can fluff up. You can take some out. Usually the pillow comes with extra that you can put in to make it just right for you. And there's a lot of pillows out there on the market that are custom designed. So just have a look at that. It's worth investing in a good pillow if you have chronic neck issues. The next really common cause of back and neck pain is sitting, just sitting, because sitting is not normal. It's not biologically normal. Our bodies are not designed to do what we're doing with them, sitting on a chair. Many people sit on a chair all day. And, back in the olden days before technology, people really didn't sit. They were moving all day. They were fetching water and chopping wood and gathering food. And then even when they did things like eat or poop or give birth, they were squatting. So sitting is just, it puts a lot of pressure on your back. And then a lot of people sit in bad positions. So like right now I'm sitting and I have my laptop in front of me and I have it positioned in a way that I don't have to look up at it or look down at it or look over here or there. If you have your screen in the wrong position, you're asking for trouble. And that goes for a computer screen, it goes for your TV. If you're sitting at an angle to your TV and you have to keep your head turned to look at it, or even, I should have brought my phone here, but even your phone. You know how many, I'll use my iPad. You know how many people I see looking like this at their phone and doing this? I mean, you're going to cause a problem in your neck if you do that. So you have to really develop an awareness of keeping things in the right position, right? Finding a way, buy a stand, make sure, like I have my laptop on something that elevates it so I don't have to look down at it. And taking breaks from sitting. If your job requires you to sit, you need to take some breaks and move around. You just have to, because you're asking you're setting yourself up for problems by sitting continuously. Also, maybe not having your legs hang down, that puts more pressure on your lower spine. So propping them up on something. Right now I have my legs up on a chair, so they're not hanging. Hanging makes it worse. And by the way, I didn't mention this, but when you're sleeping in a position that doesn't strain your back, so the best position to sleep in is on your side in a fetal position with a pillow between your knees. That takes pressure off your back, or getting a body pillow to support you. If you're a back sleeper, put a pillow under your knees. And then sleeping on your stomach, sleeping face down, isn't really a good idea. It puts too much of a curve into your lower back, and it also is not good for your neck. So if you're a stomach sleeper, you can break the habit by wearing a shirt to bed with a pocket in it and put a tennis ball in the pocket. And then when you turn onto your stomach, you will wake up. I did that. It actually worked really well. The next really common cause of hurting your back is doing silly things like you're bending to reach for something. Let's say you drop something and you're bending to reach for it, but it's like it's over there and you twist while you're bending. It seems so silly, but that's a really easy way to injure your back. So it's just a matter of developing an awareness that if you drop something, turn your whole body and before you bend over, and try to bend from your knees. Try not to bend from your waist to minimize the risk of injuring yourself. And then, just incorrect ergonomics are another common cause of back pain. So by ergonomics, lifting the wrong way, lifting anything the wrong way, that includes, babies and children and animals and objects. And if you're exercising and lifting weights, I see a lot of people at the gym lifting weights in a way that strains their back. So let's say I'm working out my bicep muscle. The only thing that should be moving is the bicep. I see a lot of people do things like this. They're swinging their whole body backward. Right? And not only are they not getting too much benefit from the exercise, but they're also putting their back at risk. So really developing an awareness of positioning and movement, and just trying to be more careful. You can't always be careful. A lot of people injure themselves coughing or sneezing. There's certain things that you cannot always control. So what can you do if you're already in pain? First of all, buying the right mattress can really help a lot. I've seen many chronic back issues go away when somebody's changed their mattress. Even your car, if you're driving a car, your car seat, if you're spending a lot of time driving, can contribute to back pain. I've seen people have a sudden improvement in chronic pain when they got a different car. So when you're choosing what car you're going to be driving, you should make sure it's comfortable for you. And if it's not, put a cushion. I have a cushion behind me right now on my dining room chair. I have a cushion in my car. Even though I have lumbar support in my car, it doesn't do anything for me. So I get my own cushions, and I really use them everywhere. I'm in a restaurant, I'll find something, roll up a sweater and put it behind me. So it's just giving your back help to be able to stay in that position. Another thing that's really helpful for chronic back and neck pain is Epsom salt baths. So Epsom salt is magnesium. Magnesium helps your muscles relax. So soaking in a warm Epsom salt bath is usually not only relaxes your muscles, but it's also anti-inflammatory. It helps pull inflammation out. Stretching. Most people are just not stretching enough, and this is especially important if you're spending a lot of time sitting. You can just do very easy stretches. It doesn't have to be anything complicated or time consuming. You can literally stretch for a couple of minutes a day. It's better than nothing. And you can find easy stretching programs on, things like YouTube. Just do some gentle stretches. If you're able to do yoga, that's nice for stretching. Even just bending forward as far as you can and hanging there, just take some pressure off your spine. And then, learn how to lift properly. Just if you have to lift anything, groceries, anything, make sure you're bending from your knees and hold the object in the middle of your body, because it's less strain on your back if you hold it here, as opposed to, let's say you're carrying heavy bags and you're holding them down here. It's pulling on your back. But if you hold them here, anything that you have to carry, if you can hold it here, it's safer. And there was something else I was going to say about carrying stuff and being careful with it, but okay, I forgot. I didn't write notes for this because it's stuff that I talk about every single day. It'll come back to me. And then hydration is very, very important, because your muscles are like a sponge. So when a sponge is wet, it's flexible. You can bend it easily and it just bends and comes right back to its original position. But if a sponge is dry and you try to bend it, it can break. It can snap. So that's the same thing with your muscles. So chronic dehydration can cause muscle pain, not just in your back, but anywhere. And it can cause leg cramps. And the most common cause of leg cramps is dehydration. So make sure that you are staying hydrated. And staying hydrated doesn't always mean drinking more water. Sometimes it means drinking the right water. I do have a water video on my channel, which I will put a link to in the description of this one. And some people are salt deficient and need to add some salt to their water. I'll put my salt video on here too, so you can see what I'm talking about. So I have, of course, as always, I have some of my favorite products that I use for back pain that I want to share with you. I'm going to do a screen share. And I take most of these on a regular basis. So I said I was going to talk a little bit more about my own issues. And first, having a heavy baby was rough. And when he was young, I don't talk about it too much on this channel, but my son was born with a rare genetic disorder, and he needed a lot of surgeries when he was a baby. And a lot of times I was having to take him to the hospital, and I, at that time, didn't have a car. I was taking him in a stroller on a subway or a bus, and everything was just so heavy, and I was constantly lifting him and carrying. And so for many years I had, chronic injuries. And then when I went to chiropractic school, we practice on each other. We start doing that before we actually know what we're doing. So a lot of chiropractors end up with injuries by the time they get out of chiropractic school. I was already a little beaten up because of my son. So I've been on a journey to feel better for many years. And so here are some of the products that I use that I love. All right, so let's start with Cramplex. So Cramplex is just what it says. It's a supplement that helps with cramps, and it's really good for any kind of cramps, menstrual cramps, or intestinal cramps, but it has some properties that relax muscle. And I love it. I find it extremely relaxing. So it has several herbs in it. One of them is called Cori, which I love the name of it, Cori. Raspberry leaf, wild yam, cramp bark is the main component, and then ginger. And this actually helps me when I have a tension headache. So tension headache is when the muscles around your neck and very often your neck and scalp, and sometimes your shoulders, your trapezius area becomes tense. And this just totally relaxes me when I take it. Okay, now the next one is kava. It's called Kava Forte, and kava is a very powerful muscle relaxing herb. So this is what you would take if you were in really a lot of pain, and it can relax you a great deal. We get great results with this. I have a lot of patients that use it. It's also good for anxiety and sleep. So if you happen to have back pain and anxiety, I would consider using kava. Next one is called boswellia. And boswellia I featured in my arthritis video. Boswellia is a powerful natural anti-inflammatory. And I use this a lot for many different inflammatory conditions, but including back pain, arthritis in the back, inflammation, really pain anywhere in your body. Again, it can even help with gut pain. And it also has celery seed, ginger, and turmeric in it. So it says here maintains and supports healthy joints, circulation, and there's also some antioxidant activity in it. Next are my favorite soft tissue supports. Ligaplex I is great if you have an acute injury, if you tore a ligament, a tendon, a muscle. Ligaplex I helps to grow you a healthier tissue back, and it's anti-inflammatory as well. It also has some bone support in there. So it says here, connective tissue and cartilage, joints, and it has bone support, and it has the stuff in it that your bone needs, like manganese. Manganese is a trace mineral that many people are deficient in. So I actually take this like every day. I've been taking this for years. And then the last one that was called Ligaplex I. This one is called Ligaplex II. So Ligaplex I is more for like acute injury. I know I said I take it every day, but I feel like I'm always injuring myself. Ligaplex II is more for maintenance of healthy tissue. So let's just say you're not feeling like you're not in terrible pain right now, but you want to maintain good quality ligaments and tendons and muscles and joints. Ligaplex II would be what you take. You could take both of them. I mean, you could take all of these all together, but Ligaplex II has some different ingredients than Ligaplex I that helps to facilitate movement and support proper formation and maintenance of skeletal tissues. So that's it. I hope this was helpful. If you need more help than what you heard on this video, I am happy to offer virtual consult. You can reach out to me at questions@drcori.com, and my name is spelled Cori, and I will put a link to that on the description of this video. I'm always willing to evaluate your specific case and offer you any help that I can. We get great results. We also help to make sure your diet is what it should be and you're not eating inflammatory foods contributing to whatever condition you're suffering from. And again, please, if you didn't subscribe yet, please do it now. I would love to see my subscribership grow. Please make sure to hit the like button because it helps with the algorithm to get it out to more people. And last and most importantly, please pass this on to anyone you know suffering from back pain that can use some help. And until I see you again, stay well.